Today, we're decoding something, well, we all experience it, right? But we rarely understand it on a truly biological level. We're talking about stress. We're going to trace the microscopic biology of pressure. And then we're diving into the heavily researched, actionable methods for recovery. Because whether you're an elite athlete, a busy professional, or just, trying to navigate the daily grind, understanding the mechanics of your own body is the absolute first step to mastering it.
So think about this for a second. Do you ever feel like you're constantly under attack by totally normal, everyday tasks, like taking care of your family, tackling a huge workload, or just sitting down to pay the bills? It's wild, but the Mayo Clinic points out something incredibly profound here. Our bodies actually treat these everyday, modern demands as literal physical threats. Your brain, it doesn't necessarily know the difference between a looming deadline and, say, a leaping predator.
Okay, here's our roadmap for today. We're covering 1. The body's alarm system. 2. When stress goes wild. 3. The athlete's vicious cycle. 4. Rewiring with mindfulness. And finally, 5. Resetting the vagus nerve. Let's jump in.
Part 1. The body's alarm system.
To figure out how to recover from stress, we first have to understand what it actually is down on a microscopic level. The Mayo Clinic perfectly describes our stress response as this complex, natural alarm system. And evolutionarily speaking, this system is an absolute masterpiece. It was designed to protect us from predators. When you face a perceived threat, say a large dog aggressively barking at you, a rapid response network inside your brain instantly flips a switch. It's a brilliant, life-saving mechanism for when you literally need to fight or run for your life.
And here is the exact chemical cascade in action. We call it the hypothalamic pituitary adrenal, or HPA axis. When your hypothalamus senses danger, it fires off a hormone called CRH. That signals the pituitary gland to release ACTH into your bloodstream, which rushes straight down to your adrenal glands. Almost instantly, your body is flooded with adrenaline to race your heart and cortisol to pump glucose into your muscles. It's this spectacular, life-saving biological chain reaction. But what happens when this perfectly evolved system is pushed completely past its limits?
That brings us to Part 2. When stress goes wild.
Look, the crucial difference here lies in the switch. Acute stress is exactly what we just described. It's helpful, it's energy-boosting, and, importantly, it is self-limiting. Once that dog stops barking and the threat is gone, your hormone levels drop, your heart rate slows down, and you return to a nice, relaxed baseline. But chronic stress, that is an entirely different beast. When stressors are always present, like financial worries or a high-pressure job, you constantly feel under attack. That fight-or-flight switch, it literally gets duct-taped in the on position. Your body never gets the signal to return to baseline.
And a stuck switch is incredibly dangerous. When cortisol constantly pumps through your veins, it permanently suppresses non-essential functions, like digestion and immunity, just to save energy for immediate survival. If those are suppressed long-term, the Mayo Clinic warns of a massive cascade of systemic risks. We're talking anxiety, severe depression, digestive issues, heart disease, weight gain, even problems with memory and focus. Chronic stress isn't just in your head, it is a physical assault on your body. To really see this damage in action, let's zoom into a specific high-stakes population.
Part 3. The athlete's vicious cycle. Drawing on some highly rigorous academic data, there is this extensive review in the Journal of Bone and Joint Surgery. They sifted through hundreds of studies to isolate the absolute best data on how sports injuries intersect with mental health. The researchers look specifically at elite athletes, people who are, in peak physical condition, but who are also subjected to immense psychological pressure, intense training regimes, and that constant looming threat of career-ending injuries.
What the researchers found is a pretty devastating bidirectional trap. First, look at pre-injury stress. The data actually shows that high life stress and inadequate coping skills strongly predict getting physically injured in the first place. Stress reduces your focus, it increases muscle tension, and it leaves the body completely vulnerable. Then, once the athlete actually gets hurt, we hit the post-injury distress phase. That physical injury strips away their athletic identity, leading to depression, anxiety, and a really profound fear of re-injury. And get this, that psychological distress actually hinders their physical rehabilitation and prolongs the recovery. It's a total vicious cycle. Mental stress physically predicts injury, and the physical injury causes more mental stress. So to break this cycle, sports medicine has really had to evolve. Physical therapy just isn't enough anymore. Clinical management now heavily features psychological interventions. They're integrating things like acceptance and commitment training, robust social support networks, and crucially, mindfulness-based stress reduction.
Healthcare professionals now fundamentally know that treating the mind is required to heal the body, which brings us right to our clinical solutions.
Part 4. Rewiring with mindfulness.
Okay, so mindfulness-based stress reduction, or MBSR. This is a standardized clinical program created back in 1979. It was born from this effort to integrate traditional Buddhist mindfulness meditation with contemporary clinical psychology. And look, it's not about magically emptying your mind. It's about developing a non-judgmental awareness, an openness, and a curiosity about your present experiences. It teaches you to simply observe stressful thoughts without impulsively reacting to them. Essentially, it gives you the power to consciously interrupt that HPA axis alarm system we talked about earlier.
Now, what does this actually look like in practice? Well, an MBSR program typically runs for 8 weeks, requiring about 45 minutes of daily homework. And the core techniques are highly intentional. There's the body scan, where you mentally sweep your attention from your feet all the way up to your head, focusing non-critically on physical sensations. Then there's sitting meditation, where you focus on your breath and simply let yourself observe the stream of your distracting thoughts, totally without judgment. And it also incorporates Hatha Yoga, using gentle stretches and postures to release tension in your musculoskeletal system.
And here is why this matters. The data proves it works. An extensive meta-analysis published in the Journal of Alternative and Complementary Medicine looked at MBSR applied specifically to healthy individuals, not just clinical patients. And they found that these techniques have a powerful measurable effect. MBSR significantly reduces perceived stress levels and trait anxiety. Furthermore, it actively reduces ruminative thinking, that unproductive, endless loop of worrying, while simultaneously increasing self-compassion and empathy. It quite literally physically rewires your baseline reaction to the world. Now let's explore one more holistic, deeply biological at-home intervention.
Part 5. Resetting the vagus nerve.
I absolutely love this metaphor from the Cleveland Clinic. They describe your vagus nerve, which, by the way, is the longest cranial nerve in your body, as a major highway connecting your brain to the rest of your organs. It regulates your heart rate, your breathing, your digestion. During stressful moments, it's supposed to direct traffic. But when you are chronically stressed, this nerve gets totally overstimulated. The highway gets completely jammed up. The relaxation signals from your brain literally cannot get through the traffic jam to tell your body to calm down. So it leaves you stuck in high gear, tense, stressed, and irritable.
But the good news is, you can actually clear the traffic jam manually. You can perform a vagus nerve reset right in your own home to naturally shift your body out of fight or flight mode. Neurologists point out that it's really all about regulating your cardiovascular and respiratory functions. When your heart isn't beating too fast and your breathing is easy, your body is forced to dial down the stress. So the single most effective, concrete step you can take: deep, purposeful breathing with intention. By slowing down your inhales and exhales, you are manually pulling the lever that tells the vagus nerve to transmit relaxation signals across your entire body.
And that brings us to our final thought. Today, we've traced the incredible microscopic alarm system of the HPA axis. We've seen the devastating physical toll of chronic stress on the body, especially in elite athletes. But most importantly, we've explored the clinical, evidence-based ways to fight back, through mindfulness techniques and by manually resetting your vagus nerve. So I leave you with this question. Now that you know exactly how your internal alarm works, what proactive steps are you going to take today to hit your own reset button?